WIKB, Iron River, Iron Mountain, Watersmeet. Now, here's Dr. Larry.
Did you know? Let's go.
You've waited all week.
Every week, we continue to learn how to achieve a better back and ultimately better health.
Live in the WIKB studios, this is Dr. Larry.
Well, thank you for the FlexiPassor read. Hello again, everybody. Okay, let's get it started. Well, as you know, every show builds on the next. Every week, we continue to learn how to achieve a better back and ultimately better health. Now, in case any of you missed it, last week we talked about anesthesia. It was an important week to be tuned in because we learned and defined about anesthesia on your brain because, let's face it, it could be a real drain. So here it is again. Anesthesia. It's not amnesia, but it does knock you out for medical procedures which you know about. However, depending on your age, anesthesia might be fine or cause your brain to dim like the lights on center stage. So the topic was anesthesia as we age, awareness. Let's dive in for just a moment. Oftentimes, I'm advising patients, referring patients, discussing with patients surgery. Mostly in my line of work, it's typically the bone, joint, or nerve style surgery, of course, like total knee replacements, hips, rotator cuff repairs, back surgery, and more. The bulk of the conversation is usually centered around questions from patients like this. How long should I wait? What is the recovery like? How soon or how quickly can I get back on my feet and normal life? Who's the surgeon you're referring me to? And so on. So that's what's on your mind. And I think that sounds about right. Wouldn't you agree? Now, what I wanted to do last week was bring up what happens to your mind with anesthesia when it comes to surgery. We know that anesthesia is part of surgery. It plays a big part. In fact, you won't get surgery unless the anesthesiologist clears you. I know situations where the surgeon was good to go, the patient was ready, but the anesthesiologist refused. And until you get cleared from him or her, surgery's not going to happen. Now, as a side disclaimer, this was an awareness topic, not meant to deter you, of course, not meant to be anti-anesthesia, not to steer you in one direction or another. It was purely an awareness. An awareness of what? That it may cause temporary or permanent brain function decline, and the risk goes up as you age. Are you aware of that? In an emergency situation and or a mandatory surgical situation, you have no choice. But the temporary or permanent effects are still in place, meaning you have to have the surgery in many cases, but you may end up with short or long-term negative effects in your brain from this. From the Journal of Anesthesiology in 2019, March 11th, the title of this article that I touched on last week was this: Lasting Effects of General Anesthetics on the Brain in the Young and Elderly, a mixed picture of neurotoxicity, neuroprotection, and cognitive impairment. So with these medical journals, they've got to sound really fancy with the terminology. So basically, toxic effects on the brain and impairment. In a little bit of a dose from this article, general anesthetics are commonly used in major surgery. To achieve, of course, the depths of this, patients are being subjected to a variety of general anesthetics alone or in combo. It has been long held an illusory concept that general anesthesia is entirely reversible and that the central nervous system is returned to its pristine state once the anesthetic agent is eliminated from the active site. However, studies indicate that the normal functioning of these targets may result in long-lasting, undesirable effects. And so I went through some of the details of that article and how in the conclusion of it, it's a mixed picture about what happens. And I gave some data points. There are, and some acronyms too, that often happens, both, of course, in military and in medical life. And there are ranges when it comes to where your risk factors are as far as age goes, and the percentages go up. I went over that last week. In slang, and this is the best way that we can all understand it, your brain, aka your central nervous system, gets washed out. And let me define some of those terms that medicine uses. Here's one of them. POD, post-operative delirium. This is a temporary condition of acute confusion and disorientation that can occur after surgery, especially in elderly patients. Then there's the post-operative cognitive dysfunction, or POCD. This refers to a decline in cognitive function or brain function that lasts for weeks, months, or even years after surgery. The executive functions are affected. What's an executive function? Discerning, humor, writing out checks to pay bills, etc. And then there's delayed neurocognitive recovery. So DNCR, and this term specifically refers to the foggy brain after surgery. Now, most of these are temporary, and I think many of you understand that anesthesia is a neurotoxin. It's toxic for your brain and central nervous system, and as long as you get the short-term temporary effects, then having surgery you need is no biggie. However, I want to tighten this up a bit and draw your attention to the subject, elective surgeries as you age. For example, you're 82 years old, your knee is bone on bone, you're overall mentally sharp, in reasonable shape, but your knee aches every day and limits function, but not incapacitates you. And you have a discussion with your team, PCP, chiropractor, physical therapist, orthopedic surgeon. Everybody says, yes, you are healthy enough to get the surgery. Though it's elective, there's nothing life-threatening. So you have it. It's a success. Knee is fixed, but not you. Your family begins to notice over time you are mentally not firing on all cylinders, and it accelerates to within a short few years, you're mentally impaired. The question I have for you now, today, when you're not mentally impaired, is, was this elective surgery worth the permanent brain dysfunction? So with a clear mind, at 82 years old, give or take, is it worth it? Could you have lived with that bone-on-bone knee? In some cases, you might not. And in some cases, you would decide, you'd be like, you know what, I'll put it off. And I've seen patients choose both. My job is to provide and help you weigh benefits, risks, rewards. And this discussion that I had last week that I'm wrapping up today, which I expanded over the whole show, was geared towards the subject matter of this that doesn't often get talked about, and it's not often revealed. Let me paraphrase a few conversations I've had with patients. Dad got his knee done in his 80s. Dr. Larry, I noticed his mind hasn't been saved since. Our whole family knows it, and it was from the anesthesia. Dr. Larry, Mom got her hip done, and she's been just mentally off since. She's okay, but something's not right. Doctors don't know what to do because they've run tests, and there's nothing they can really do about it. So think about this. Do you have a family member that now, hearing this, has this potentially happened to? Another question, are you facing an elective surgery? And it doesn't have to be some type of joint replacement, but it's elective. It could improve your quality of life in some way, but is the risk of the brainwash from anesthesia worth it? And if you have a question about this, you can log on to wikb.com, click the Ask Dr. Larry form, and send me a question about this, and I'd be happy to respond. This is open while I'm doing the show. Again, wikb.com, scroll down, click the Ask Dr. Larry, fill out the form, and I will respond back. Do that while the show is live. Now, to wrap this up, of course, what we have to infuse in this conversation is Alzheimer's and dementia. You pretty much, in your own independent research, probably won't be able to find a direct correlation between anesthesia, Alzheimer's, or dementia. But let me draw back to one line from the article that I had mentioned. Anesthetics have also been shown to promote another hallmark pathology of Alzheimer's disease. So what that would indicate that is if you are predisposed, what that means is family history, etc., to dementia, Alzheimer's, that sort of thing, it may or may not accelerate that. From medicalnews.net, typically older patients are more likely to experience POCD. Now you know what that is. With around 40% over the age of 60 who are hospitalized for surgery experiencing POCD on discharge, and 10% 3 months later. Now, there's a sidebar discussion to this, because what happens is oftentimes people come out of anesthesia and they're making silly jokes, they're saying wild things, and it can be kind of humorous. There is the humor side of this, and I think any of you can relate. And when I was doing the show last week, somebody shared some discussions with me about that. That's what happened in one case, just kind of like I said, funny, blurt out stuff. That's part of the process. That's the short term that you're hoping for. But what I'm focused on is the long-term effects. These are discussions that I have with patients in private who have told me, literally, this is exactly what's happened. So I wanted to make you aware. That was part one of the show. Part two, I shifted gears a little bit with a tie-in. And I reviewed for you medical waivers, because it does tie in. And when it involves having surgery, you have to sign a medical waiver, which includes some of the effects of anesthesia, of course, anything that can happen in the surgery. And in boldface type on top was, do not sign this form without reading and understanding its contents. And what I did last week in part two was go over what a waiver is, and to give you a little bit of a quick kind of whet your palate appetite for this, it's the act of intentionally relinquishing or abandoning a known right, claim, or privilege, and that's the legal instrument to do so. So that's what a waiver is. You're giving up your rights to have the surgery voluntarily, and I went into voluntary consent, what that means. Again, these waivers, it says, do not sign this unless you know what this means, and that's why I did that as part two of the show last week. There was more. However, if you missed the entire show and want to be more in the know, then log on to my website, drlarryradio.com. Hit the subscribe button, follow the links, and listen to that show. It's been uploaded now, which you can listen to at your leisure as a podcast. And so here is the final point. In addition to the brain drain, last week we learned a simple self-test for knee health. It was another Dr. Larry cool tool, and you can call my office for a freebie reminder just in case you're in need of a retip or a tip up. And so that was last week. Yeah. Now today, we'll forget that monologue for a moment and keep remembering those mandatory communication skills all doctors must have, which are inquisitive listening and staying positive. Again, it often means the difference between sick and well. Also, it's another month of the year, so let's keep our calves in gear. I always think of cows when I say that, but no, it's not cows, it's our calves. So in our tip and trick segment today, we're going to learn a simple self-test for a strained calf muscle. And of course, you, Rito Dorito, back in the booth, quiet man radio, calling out right from the broadcast booth while we crank up the tunes and I hit the center stage for the demo. However, before all that, in order to have good health, you don't need a lot of wealth. So let's flex our forebrain and put some knowledge to the game, because today we're going to talk about, hit it, Pearl.
Dr. Larry brings you another segment of Did You Know?
MOBIC. MELOXICAM. Thank you, ma'am. Because it's the NSAID that could be a grand slam for reducing inflammation and joint pain related to osteoarthritis. Let's face it, we ache as we age, just like Johnny Unitas. So if you are fine with being a bit of a pill popper, then stay tuned to learn how this medication can be an arthritis pain stopper. MELOXICAM, how it works, why it works, and of course, what are the side effects. When we get back from the break, stay tuned. You're listening to the Dr. Larry Radio Show.
Dr. Larry. We'll be back in a moment.
Your healthcare should be about what's best for you. Yet too often, healthcare professionals focus on keeping patients within their system, including who they refer you to. I'm Dr. Jason Klein, orthopedic surgeon and physician owner at OSMS. You should be seen by who you want, and you can be. At OSMS, our focus is on providing you with the highest quality of care in a safe environment. The best part is, you usually don't need a referral for orthopedic care. Learn more at askforosms.com.
I would never recommend buying a home without having the water tested first. It's cool, it's clear, it looks clean. Oh, it tastes good. Well, what's really in it? And we just recommend that you check it out. I'm Jennifer Toivonen. I'm a co-lab director at Whitewater Associates of AMISA. Coliform bacteria, lead, arsenic, nitrates. You want to be sure that water is safe. I would recommend giving us a call. That way we can tailor the kit that we send to you for what you need. 906-822-7889. Give us a call.
This is Lois from Crystal Falls, and you're listening to Dr. Larry Radio.
An audiologist has extensive training preventing, diagnosing, and treating hearing and balance disorders. Research has shown people tend to underestimate the degree of their hearing loss. Rather than just selling hearing aids and fitting them, we try to look at the person and where he is as far as counseling and guidance on his hearing journey.
There's never been a better time to start hearing what you've been missing, and Lori LaFleur at Tri-County Communications will help you every step of the way on your journey to better hearing. Visit her office at 609 Central Avenue in Florence, Wisconsin. Give her a call at 715-528-4350 or find help online at TriCountyAudiology.com.
Does your financial advisor take the time to really listen to you? Is your financial strategy personalized to you and your family? Will your financial advisor be there as your life and financial situations change? When you work with Ryan O'Grady, your Crystal Falls Edward Jones financial advisor, he focuses on what's important to you. You'll work together and use an established process to create a personalized financial strategy, backed by the advice, tools, and resources to help you reach your goals. And you can partner long-term to help your strategy stay on track. Contact Ryan today at 906-875-3833. Edward Jones, member SIPC.
At West End Home Furnishings, downtown Iron River, we have 2 showrooms full of furniture for every room in your home. Need carpet? We have that too. We're open Monday through Saturday and can be found online or by calling 265-1401.
Break's over. Time to get cracking once again with Dr. Larry.
Welcome back. 3 men, roughly around the same age, had joints that began to rage. One, his knees were shot, but wanted to still play softball a lot. Man number 2, his shoulder began to sing the blues, and, well, man number 3, his shoulder was past the point of normal activity. So what do all 3 of these men have in common besides their arthritic aches? Relief from some of their pain and grief. And how? I suggested to have their primary care provider prescribe a medication called MOBIC, M-O-B-I-C. Now, before you turn on the radio, call your PCP, find a script, let's go through the how, the why, the side effects to see if this medication is right for you. And let me preempt the whole discussion like this. People take pain-relieving medication like NSAIDs and Tylenol. Ibuprofen, of course, is one of the most common NSAIDs. It's reality. Even patients say that they don't want to take pills like ibuprofen or be on pills. If push comes to shove, many do. So knowing that I'm a doctor of chiropractic who treats pain, then I want to give you, patients, the best practical, well-rounded advice with the understanding of medications like MELOXICAM, or AKA MOBIC. So if you're going to take an NSAID, then might as well try something that for many is more effective to reduce inflammation from osteoarthritis. I could have a broad discussion on alternatives like fish oil, diet, etc., but that's not the focus today. The focus today is for those patients, those of you, and there are many, who don't mind taking medications, and I'm not here to indoctrinate you on the alternatives right now because this is more of a mainstream talk. So here we go. MELOXICAM. What is it? Sold under the brand name MOBIC, among others, it's a non-steroidal anti-inflammatory drug, an NSAID, used to treat pain and inflammation from osteoarthritis. And how does it work? If I said the word finish, what immediately comes to your mind? Finish. Finish is a noun. And a definition would be a final part of something, especially a period of time, an activity, a story, the end of the year. The furthest, most extreme point of something. Finish. A goal. Or it could be finish relating to the characteristics of Finlanders, Finns, finish. So when we use the word finish without context, we lose meaning. Same as pain from nerves versus pain from joints versus NSAIDs versus non-NSAIDs versus everything that's out there in the market that ties into the treatment of pain. So most often used phrase without context, like NSAIDs or ibuprofen, you might be taking the wrong one, or we might be talking different language. So for context, I'm going to make sure that you get the maximum relief from your osteoarthritic pain as you hear me peel away why meloxicam works for certain osteoarthritic conditions, and we're going to dive into the how. So then we're talking the same language. Now this is important for you to understand because it helps you grasp should you consider this medication versus just gulping it because you were told to or you were given it. Also keep in mind, if you have nerve pain versus joint pain, there is a difference. First, let's establish what osteoarthritis is. OA for short is the painful chronic disease of the synovial or slippery stuff inside your joints and is the most common form of arthritis. And now they consider it a disease. So even like on our diagnosis codes we use, you'll see degenerative joint disease. They actually put that in front of there. It sounds horrible, and of course it can be painful and life-altering as osteoarthritis goes. And additionally, it's the altercation or alteration arising from imbalance between repair of a joint and the destruction of the joint as you use it over time. So it's a very passive disease. It creeps up on us. That's what happens. You heard me mention with Jim on telephone time when I'm sitting in the back seat of the car, as I sometimes like to do just to get a different vibe. I got to extend my left knee out a little bit. 51 going on 52, the knee gets a little more achy. Osteoarthritis. The start of OA involves contributions, of course, from multiple personal reasons: age, activity, what you did, what you don't do, weight, etc. Symptoms of OA are, of course, pain, joint stiffness, reduced function, and main symptoms are instability, swelling, creaking or cracking in the joint, some muscle weakness, and then the pain-related effects of all that too. You know, it's just in the middle of the night. You're aching like crazy. That's osteoarthritis to the T. You may have intermittent intense pain, and then it slows down a little bit. It might be a steady hum, and then it kind of starts to increase over time. There are multiple varieties of how osteoarthritis begins to present itself. The mechanism of this is where we really have to focus if you want good medication for your osteoarthritis pain. So listen to this. The hallmark of OA is damage and remodeling of the joint surfaces. And as you know, it creates spurs, hardening, and cysts can develop. And the progressive loss of the cushy stuff, the cartilage, develops into narrowing. I just looked at a knee x-ray last night. The lady has knee pain. She's in her early 70s. And I had to double check to make sure that she didn't have any of this on her x-rays. So that's what we're looking for on the practitioner side of things when we're diagnosing from a film in addition to history and exam. Studies show that pain has a strong association with OA. Pay attention to this. I've got this underscored and bold-faced. Inflammation plays a key role in the development and the onset of OA and contributes to the chronic pain. It triggers a cascade, a sequence, ABC, 1, 2, 3 events, one after another, driven by inflammatory mediators or inflammation components. So just like the function of anything, This radio station has a function. There's airwaves that go out. In order for you to hear me right now, there's a sequence of events that have to happen to have that successfully. That's the same thing as inflammation. There's a board, there's a microphone, there's inflammation. How inflammation is created is where these medications can target and either offer you relief or not relief. And a little sidebar comment, what I'm trying to do for you, as I've done for patients in my office, is if I know and see a patient just popping ibuprofen like crazy, you know the drill. I mean, it says on the bottle, take 3 a day, 200 milligrams, so that would be 624 hours, right? What is the reality? It's 3 each time, 4 times a day. You're taking 1,200 milligrams, 1,800 milligrams. When I've seen that, I've put a stop on it, talked to them about this MELOXICAM, and said, let's try this for your knee and for your hip or for your ankle, and have the PCP see if they would like to prescribe it. And this is where the success starts to come in, from 12 ibuprofen a day to 1 MELOXICAM. How does that work? Why is it more powerful, and what are the key elements of this? It's how it targets the inflammation within the joint, and you're going to hear that here in just a second. So the inflammatory conditions, it's a process. It has a theme to it. NSAIDs, non-steroidal anti-inflammatory drugs, are the large group of prescription over-the-counter medications that are typically used. Advil, Motrin, Aleve, and diclofenac, as a patient mentioned to me this last week. Sometimes that doesn't roll off the tongue easy. In comparison, the more common NSAIDs, ibuprofen, naproxen, I'm going to add that one in there too, usually affect 2 types of enzymes or processes or mediators for your inflammation. And they're called COX-1, COX-1, and COX-2, COX-2. You're not going to be quizzed on this, but you have to hear why. MELOXICAM blocks COX enzymes, the mediator, the whole process or part of the process for inflammation, and is responsible for blocking and not allowing the factory of inflammation to start. It selectively, at low therapeutic doses, inhibits the COX-2 enzyme versus the COX-1. So 2 enzymes in place. Think of 2 molecules floating around inside your knee, let's say, and together they start to create inflammation. MELOXICAM works to block 1 and also 2 of those processes. There's hormones involved too, not like the female hormones they're thinking about. There's a hormone in place that involves inflammation as well too. So you get joint swelling. So you take a look at your knee. Knees are really easy to talk about. You look down and it's a swelled up knee. As the day goes on, it gets bigger, gets a little hot and red, it gets stiff. How that knee gets bigger and redder involves something where it ties into a process of hormones and mediators, okay? So again, like Lego pieces chinking together. Now, in part, if it sounds like that I'm reading some of this to you, I am, and it's for a reason. But what I did was I broke out all of the really mucky scientific stuff, and I'm drilling it down to 2 things: blocking enzymes correctly with the right medication. So if we go back to a Lego analogy, is if you are trying to build inflammation, your body is, because of osteoarthritis, and it's cinching Lego pieces together, you would want to take something that would block the next block to be formed so you don't get an inflammation. That's where this medication comes in. So it blocks that process. It blocks one of the Lego pieces. It's how MOBIC starts to work in your body. Now let's piece some of this information together in contrast to ibuprofen and why you have to take so much ibuprofen, where maybe you only have to take a little MELOXICAM, which overall is going to be easier and better for you on your liver function, your kidney function, on your guts, you name it. Meloxicam, or MOBIC, is considered stronger medication than ibuprofen, is only available by prescription. However, it has long-acting effects. So meaning it only needs to be given or taken typically once per day. Ibuprofen, in its usual form, as you know, typically has to be given in higher doses 3 to 4 times per day to have the equal effect. So for efficiency standpoint, to block those two enzymes, or the Lego pieces I talked to you about, it would make more sense to use something that's long-acting, gives you 12 to 24 hours of relief that you only have to think about take once a day versus going every 3 hours. I mean, by the time you wake up, you pop 3 for ibuprofen. Next thing you know, it's mid-morning. Oh, I got to pop another 3, and you know the drill, or 2 or 1 or whatever it is. So the meloxicam component and how it was created is specifically for this reason alone and why it works really well. It's very selective to target the building blocks of inflammation and swelling within your knee. There is another cousin to this medication called Celebrex, and I'm sure you've heard of both. Maybe you know people that are on one or both of these, or I should say not both, but have been on these. And this is the reason why they have success and why the 3 guys that I mentioned at the top of the show have success. So Celebrex and meloxicam do vary in their methods and how they work and how they target. I'm going to just jump right in and tell you Celebrex avoids some of the intestinal lining issues like ulcers, like your guts hurt because you've taken too much, where meloxicam does not. However, Celebrex only targets one of the 2 building blocks for inflammation. So let me repeat this in a different way. Meloxicam does 2, both of the building blocks, knocks down the inflammation, and also long-acting. So by and large, really helps a lot more than ibuprofen. Celebrex, however, meloxicam can affect your guts. It can, and it has some other side effects as well, too. Celebrex has a lesser effect on your guts, so it can spare the lining in your stomach and therefore still produce that anti-inflammatory effect. However, it does not target one of those 2 main key enzymes that produce the inflammation. So, again, weighing things out, this is what you have to do, and you also have to know how to properly understand what these medications do. So if you're thinking back and you've got knee pain right now, you've got joint pain right now, take a deep breath for a moment. This is key for you taking Aleve, Motrin, ibuprofen, generic or not, or going to your PCP and asking for a trial of meloxicam or Celebrex now. I've infused that into the discussion, but it's mostly about meloxicam. Because what I'm going to do after the break is I'm going to repeat this for you in more of a table format. I'm going to help split the difference up for you so you hear it and you get those nice, easy grab-and-go points. And if you stayed with me right now, you should have a better understanding, at least to some degree, of how and why there are different varieties of these medications. And going back on the clinical setting, like for these 3 guys that I'm talking to you about, and other patients as well, when I see this, I know the mechanism of action, and of course know what these medications can do. Even though I don't prescribe them, I have to know what they do, so therefore I can effectively offer advice so the patient can go back to their doctor and have an effective discussion with them. So, OA in the knee, osteoarthritis in your ankle, your wrist, etc. Meloxicam versus ibuprofen or any of the NSAIDs, Aleve, and now I've added Celebrex. If you have this problem, log on to WIKB.com, click the Ask Dr. Larry, ask me your osteoarthritic question now while I'm on the air, and I can help suggest which one might be beneficial for you to talk to your doctor about so they can prescribe. So again, WIKB.com, scroll down, click the Ask Dr. Larry button. All you have to do is easily to help you out, just to know what to put on that form there is, let's say you've got, I'm this age, this is my activity level, this is where my joint pain is at, and this is what I'm experiencing, this is what I'm taking now. I can help suggest to you if you're taking the right stuff. Oh, that sounds good, like I would do for a patient that comes to my office. Or I suggest you maybe try this and talk to your doctor about that. I will do that for you if you log on right now and do that while I'm in the air. Okay. Bueno, this good? Free advice brought to you by WIKB while I'm here on the air. Use it. Stay tuned for MELOXICAM, Celebrex, ibuprofen when we get back from the break. This is the Dr. Larry Radio Show.
We'll be right back with Dr. Larry.
What's cooking near you? Head to one of these fine local establishments for your next bite or beverage.
Fuzz and Schmooze Mid-City Bar in Caspian opens 11 a.m. 7 days a week. Sandwiches, burgers, deep-fried appetizers, shrimp and fish served 7 days a week. Call 265-9277 for carryout.
The Habit Bar and Grill, Highway A in Nelma, Wisconsin, and on the ATV Trail, offering premium gas. Opens 10 a.m. 7 days a week. Daily specials. Call 715-545-2646.
Kukal Eyes Bar in Channing's open at 11 a.m. with happy hour 3 to 6, 7 days a week. Weekends, $5 loaded Bloody Marys and mimosas. Always serving Summer Place Pizza. Voted #1 bar in Channing. Check out Kukal Eyes on Facebook for specials, live music, karaoke, and events.
The Alpha Michigan Brewing Company on the Circle in Alpha opens at 3 Tuesday, Wednesday, and Thursday, and noon on Friday, Saturday, and Sundays. Call 920-358-9551. Go to alphamibeer.com or find them on Facebook for tap menu and events.
The Horseshoe Bar downtown Amasa opens at noon 7 days a week. Burgers, sandwiches, nachos, crazy bread, specialty homemade pizzas, and deep fryer snacks too. It always tastes better at the Horseshoe Bar downtown Amasa.
The Local Eats List from WIKB WFER.
At UP Propane, serving you is what we do.
Hi, this is Dan from UP Propane. Summer's finally here in the UP, or is it over? Regardless, if you have a propane project that you'd like done, give us a call and we'll take care of you. We take care of all your propane needs. Remember, we're the local guys that live just down the street. UP's going green. Give us a call. In Iron River, call 265-4342. That's 265-4342.
This Northwest Weather Report is brought to you by Peak Metal Roofing. Top quality solutions that are durable, stylish, and built to withstand the UP's toughest elements. Upgrade with the best. Call 906-370-0734 or visit peakmetalroofing.com. Peak Metal Roofing, where strength meets style.
Here's your Iron River and surrounding area forecast. A frost advisory begins at 1 a.m. tomorrow morning and remains in effect until 8 a.m. tomorrow. 64 this afternoon, under mainly clear skies, northerly winds 8 to 15 miles per hour. Lows around 33. Tonight, mainly clear skies develop with fog at times. From the Weatherology Weather Center, I'm meteorologist Jennifer Wojcicki on WIKB. Currently, it's 64 degrees.
This is Mason from Iron River, and you're listening to Dr. Larry Radio.
Jensen Akins is your Whirlpool Appliance headquarters. Whirlpool, Maytag, Amana, KitchenAid, brand names you know and trust, and all at the Northwood's most trusted choice for your kitchen appliances. We don't just sell Whirlpool appliances, we also service them. Prices that beat the big box stores with a service that the others don't offer. That's Jensen Akins of Conover. We may be small, but we deliver big savings. And remember, we service what we sell at Jensen Akins of Conover, of course.
We're back with Dr. Larry.
3 men, roughly around the same age, had joints that began to rage. One, his knees were shot, but wanted to still play softball a lot. Man number 2, his shoulder began to sing the blues, and man number 3, well, his shoulder was past the point of normal activity. So what do all 3 of these men have in common with you, besides their arthritic aches? The relief they got and the grief that they no longer have. How? I suggested to have their primary care doctor prescribe a medication called MOBIC. So as you heard from the previous segment, some medications, non-steroidal anti-inflammatories, are more effective for targeting 2 of the main building blocks of the inflammatory process that happens within your joint. And for that reason, if you want to treat it with NSAIDs, then you might as well stack the deck in your favor with the one that has the precision way to do so. meloxicam being one of those. And the reason why, they've also done studies where they found in animals, not humans, but mammals, meloxicam was within the slippery fluid and cartilaginous area. So it crossed the barriers to get there, to get to the site, to where it needs to go for the medication. Isn't that the intent of taking a medication? So you take an NSAID by mouth, and you've got a hip or knee osteoarthritis, and your ankle, or all of the above. I know people that have every joint almost that has osteoarthritis in it. The preference would be to have the medication target within the joint what's going on. Some of the other stuff, like topicals that I've gone over, and I just did this for a patient last week who tweaked her knee, and she tried all of the holistic stuff, the rub-ons, everything that would be non-steroidal anti-inflammatory or holistic, and none of it was working. And I had her go get something called Voltaren or diclofenac, which is a non-steroidal anti-inflammatory, and rub it within the ligament. It was right there at the tip of the bone on the ligament inside of the knee. She didn't have osteoarthritis. She just had acute inflammation from tweaking her knee, and within 3 days it disappeared, and she had it for roughly 10 days. So there was a targeted NSAID for an acute knee pain. Flip it around, would meloxicam work for that acute knee pain that was basically from a strain, tendon, or ligament, or sprain? Maybe, could, but it wouldn't be as effective. So the topic and discussion is for chronic, progressive, ongoing, debilitating osteoarthritis, short of having surgery or scopes or injections, and we're not even talking about steroids. We're focused on the NSAID component. So again, we've got a few minutes left in this segment and the show. Log on to WIKB.com. Click the Ask Dr. Larry. Send me your question. I will respond after the show, but bring those in during the show, and I can help suggest to you if you're on the right path or wrong path when it comes to treating these with NSAIDs. It's not, and I guess the whole purpose, and I did this show before, and I cleaned things up a little bit and tightened some things down and ratcheted down, because it's real simple to just go to the pharmacy, grab an ibuprofen, maybe the cheapest one, off the shelf, throw it in your grocery cart, and then just take it, or you've got Aleve and Motrin and all that kind of stuff. So because your intent is to treat the inflammation and the pain that you're experiencing, I think we can agree with that. Therefore, I'm helping you understand what to grab and what to suggest so it targets your pain better. That's the whole point of this. Rolling back the clock a little bit, as in anything, there is a process where inflammation is created within the osteoarthritis part of the joint. Now, this may come as a little bit of a surprise, but the synovial fluid area and also the cushion part of the joint does not have any pain receptors to it. So how in the world could you have pain in there if there's no pain receptors? Well, as the knee or the joint begins to age and degrade, it exposes some of the nerves from the surrounding area, and therefore the inflammation begins to start. That's how it begins. So it can be within some of the bony plates around there. It can be some of the tendons or ligaments around there, and that's why sometimes even ice can help. But the point is the inflammation starts and gets created outside of the joint, but it has to get there somehow and expose it, and it's because the cushy stuff starts to degrade. So, meloxicam, I'm going to go through the what is it again name. It's sold under the brand name MOBIC, among others. It's in the class of non-steroidal, so it's not a steroid, anti-inflammatory drug. And again, that's a term when we're talking about language here, and we're talking about using terms. Oh yeah, I take ibuprofen for my knee. Okay, what type and why? Now what you can do is you can say, okay, I take meloxicam for my knee because of what I'm going to help you out with here in just a minute. Or I take Celebrex for my hip because, or I just take Motrin for my ankle because, or my wrist. And this is why and how it works and why it's effective. It's the mechanism of the action of the medication and how it counteracts the process of inflammation. So there's, within the process of inflammation, of course, vessels have to widen and dilate. There are these special enzymes, and we can use all the analogies we want, like even making bread. You got to have yeast, and you got to have a little salt, and you got to have some flour, and you got to have some water. And if you do all that and then make it and then let it rise, and then you put it in the oven, voila, you have bread. It's a process. So think about MOBIC in the same sense. Bread rising could be inflammation, expanding, and if you come in with a targeted medication that pokes that bread, deflates it, or stops one of the enzyme processes, like doesn't let the yeast work, you got some pretty flat bread. So that's kind of an analogy to help think in your mind too. Also, if you try to stop the yeast with something that doesn't work and the yeast keeps on growing and the bread gets bigger, then you're basically not, or just slows it down. That's the analogy for the whole anti-inflammatory pill-taking effect. So, two enzymes, COX1 or COX1 and COX2. You'll have to know that. And if you say that to your doctor, they're going to be impressed. Hey, does this inhibit COX1 or COX2 or both? And they're going to look at you like, either you've been on the internet or you've been scientific in some way. So COX1, COX2 is what you want to know. So it's a chemistry experiment. That's what medication, that's what the whole thing is about. Now let me define this in terms that we all understand up here. Bait. As a fisherman, you understand bait. Bait to target certain things. Bait for panfish, maybe certain lure, let's say, for crappies, walleye. Well, let's say you want to target smallmouth. How you do that? Brookies. Who doesn't like a good brookie? How about if you want to get a northern? The bait or the lure that you use is specific for the fish. And if you're trying to fish for inflammation, and you want to use the right bait or lure, then you've got to pick the right NSAID. No question about it. You might be able to snag a smallie with a northern, but the deal is if you want to target the certain thing, the type of fish you want. If you want a walleye, you better fish for walleye. You might get lucky, but you better, and you have to know where to fish. So same thing with these medications. They know where to fish. Okay, I'm going to give you a little bit of this final kind of table here to help you understand on how to target. MOBIC, low dose, is long-acting, and it can help target one of the two enzymes. Higher dose can do both, so you get a long-acting double dose, so 7.5 milligrams and up is usually what they prescribe, okay? That will help for long-acting. If you have tummy problems from taking NSAIDs, you may have to shift to something like Celebrex, which I'll say is a cousin to MOBIC in a way. And Celebrex targets one of the two, but it doesn't affect the tummy as much. So there's your two to play with. If you are still having pain, of course, then there's other methods and means, but the target of the show was to describe the NSAID to work. So you got 3 varieties now that you can talk to your doctor about. Regular over-the-counter for your osteoarthritis pain, MOBIC that you heard bulk majority of the show on, and Celebrex now. And the reason why, those are 3 different lures that help target the inflammation within the joint. That's what you need to talk to your doctor about. Okay, upcoming announcements and our tip and trick of the week just around the corner. This is the Dr. Larry Radio Show.
Dr. Larry will be back in a moment.
An audiologist has extensive training preventing, diagnosing, and treating hearing and balance disorders. Research has shown people tend to underestimate the degree of their hearing loss. Rather than just selling hearing aids and fitting them, we try to look at the person and where he is as far as counseling and guidance on his hearing journey.
There's never been a better time to start hearing what you've been missing, and Lori LaFleur at Tri-County Communications will help you every step of the way on your journey to better hearing. Visit her office at 609 Central Avenue in Florence, Wisconsin. Give her a call at 715-528-4350 or find help online at TriCountyAudiology.com.
Tune in tonight for Iron County High School football on Listen Up Radio. On 99.1 FM, the Forest Park Trojans hit the gridiron against the Newberry Indians with the pregame show starting at 5:30 and a 6 p.m. kickoff with Troy Margoni calling all the action on the field. On 97.9 FM, the West Iron County Wycons take on the Calumet Copper Kings. Pregame starts at 5:30, kickoff time at 6 with Rich Sawicki calling all the action on Nelson Field. Iron County High School football on Listen Up Radio, WIKB, WFER.
Brought to you in part by Stevens Real Estate, S&S Tree Works, Alice's Supper Club, Covantage Credit Union, Auto Dock and Towing, First National Bank and Trust, Remax North Country, Young's Golf and Recreation, the Iron Area Health Foundation, Shamco, Peninsula Title Agency, Punch Out Contracting, Town and Country Sales, West Falls, Marla Shamian State Farm, Connor Sports, Crystal Lumber, Wickwire, Overlands Incorporated, State Line, Mario's Outdoor Power Products, and Nash Funeral Home.
This is Scott from Crystal Falls, and you're listening to Dr. Larry Radio.
When other small local businesses talk to me and ask me how my experiences were on WIKB and telephone time, I tell them, I say, there's no better way to go in the UP in northern Wisconsin than WIKB. This is Kenny from Thermal Chaos Pub. We've been advertising with WIKB for over a year and a half now. Working with the crew at WIKB is like basically being part of the family. Buckskin Bob, great to talk to, easy to get along with. Get along with Jim on TT. Helps a lot when you have a really close group of people to work with. Number one in service, number one in getting customers into your business. This is Kenny from Thermal Chaos Pub,
the fun bar in Dunbar.
So please do try WIKB telephone time.
Hello, baby.
Sammy Hagar's Top Rock Countdown is Saturday nights on 99.1 FM.
Rockin' the up.
Actually, it's UP, Sammy, like Upper Peninsula.
Well.
Yeah, but anyway, tune in at 5 p.m. on Saturdays.
Oh, yeah.
For 2 hours of the Red Rocker counting down his favorite classic rock with themes like best album openers, best B-sides, best solo artists. Every week is something new.
Don't miss it.
And if you do miss it, the Sunday afternoon rerun is on at 3.
Mas Tequila!
It's like 10 a.m., dude, but all right. Classic rock and your favorite hits in the Top Rock Countdown on... Can you tell them, Sammy?
WIKB-FM, Iron River.
Breaks over. Time to get cracking once again with Dr. Larry.
Okay, a couple of things before we wrap up the show and get to the weekly tip and trick. Here's a list of possible upcoming shows and some updates. You get the shiny new hip and bionic knee. You talk with someone like me, the surgeon, nurses, and more, but how often do you ever get to hear directly from the manufacturers and distributors of these parts? What kind of information do they have to offer you? What potential benefit to you as a patient? I did an impromptu survey with some people. One lady, I said, you've got a hip replacement. What's in there? She's like, I don't even know. I don't know the name brand, Dr. Larry. Another guy, I said, you got a knee? What kind of brand you got? What's your knee? He's like, I don't know. Another lady, she had 2 hip replacements I had to send her out for. And she said, I think I'm going to call the doctor and find out what I got in there. I said, of course, we know what kind of vehicle we have parked in our garage, a Chevy, a Ford, etc. But what kind of part you got parked inside your joint? Well, I've got a representative from the Division of Orthopedic Implants from Johnson & Johnson going to come on the show. Probably going to square that up sometime in September, I hope. Have you heard of the medication amiodarone? Do some research on your own. Well, it's a heart medication with serious potential side effects, and your physician should be following the protocols if you're on that medication or your loved one is, or some of you know. So make sure that at some point I'm going to have a lady come on the show to talk about what that medication did to her husband's lungs. Coming up in just a few weeks, Queen City Running, now open in Iron Mountain. Paige, one of the owners, is coming back on the show to talk about the shoes they have for everybody. She said most of our business, Dr. Larry, is actually from not runners, but they do a lot of running, of course, at Queen City Running. And by the way, if you heard this mentioned on the show, you'll get $20 off. All you got to say at Queen City Running at any one of their 3 locations, hey, I heard on Dr. Larry, I'm referred in from Dr. Larry, I heard this mentioned on the show. They will give you an immediate $20 off the purchase of a regular price shoe, which they've already got great shoe prices, and they've got the 7-step process where they fit you for the right shoe, and it works. I tested it. They know what they're doing. They've got a great process there and a great little warranty program they have too, I think, in the first 30 days. So, and overall, they want to get you in the right shoe. That's their point. And I'll tell you, you can order certain things online, and I know you can order shoes online, sneakers, walking shoes, but to go get fitted and make sure it's right and be able to talk to somebody and kind of test them out, that's what Queen City Running is all about. So any 3 of their locations, just tell them I sent you. You get $20 off. I want to give a special thanks to Dorito, the quietest man in radio, back in the booth. Keaton, you heard her voice, the Edward Jones ad, does some help for some of the graphics on my website. Also, don't forget to check out the link on WIKB.com, as I mentioned earlier in the show. You got a few minutes. If you got a question, send it in to me. I will respond back and answer, as every week now people are sending in questions. Also, my own website, drlarryradio.com. That's the 2 you got to know today, WIKB and drlarryradio.com. You can listen to some of the old archive shows on there. There's a link to subscribe for some of the other shows. I think I got over 150 in the bank now. And if you didn't know, I'm on all of the platforms as far as like Spotify, Apple Music. It is by show topic, so you might have to dig a little to find me, but then you'll find me and you'll find a list of shows if you're on any of those platforms. Even Pandora. I have a download from a show read that was, it was an island I never even heard of. It was an odd one, like off the island of Denmark or something. I had to look it up. Never even heard of it. All this time on the earth, never heard of it. So anyway, Reed, it's time for the weekly tip and trick. You head up to the broadcast booth. I'm going to head out center stage for the demo because today we're going to learn a simple self-check for a strained calf muscle. These babies hurt.
All right, folks, Dr. Larry doesn't skip leg day. Currently sitting in his chair, bending down, kind of feeling and like grabbing, squeezing the back of his calf, making sure everything's all right.
Good job, Reed. I couldn't have said it better myself. Apple doesn't fall too far from the tree. It's fall out there. Did you know? Did you know? It's August and it's fall. Strained calf muscle. Oh, man. If you blew a calf muscle, you know it. You probably don't even need me to tell you, but I'm going to tell you anyway. Reach back behind there. Feel if it's bulging. Hard is a big one. You might have pulled that calf muscle. There's a couple big ones back there. The gastrocnemius sounds like, I don't know, like a strong man. Gastrocs. And then you got the soleus. Always love those 2 names. Those are your main calf muscles. Your gastrocs, your soleus. Of course, they form into your Achilles tendon. So if you pulled your Achilles, that tendon, your Achilles, watch out. You need that little bad boy. They do lots of stuff. Simple self-test. Just reach around, grab it. Typically, patients say it feels like they got shot in the back of their leg when this thing blows, and it's just basically a loud and also hurtful injury. That's a strained calf muscle. Folks, remember, you can listen to me live right here every week to learn how to achieve a better back and better health. Or if you're having a pain or problem, you can see me for real. I'm here to help. My number at the office is 906-875-3215. Have a good day, boy on the board, and I'll see you next week, everybody.
WIKB, Iron River, Crystal Falls, Iron Mountain, Kingsford.